do you say to a patient who's coming in and sees Google Glass and may be a little bit hesitant about a patient-doctor communication with Google Glass? How do you sell the patient on the benefits of Google Glass for that patient?
Yeah, well, interestingly enough, I think it was Augmetics again who many months ago did a survey on 200 plus patients, and they really had very good feedback from the patients in regards to this piece of weird looking, frames in the forehead. Most patients, I can't remember the statistics, but most patients didn't mind, most patients liked it. Anyone who tried them on was amazed, because anyone who puts glasses on and looks at the little screen in front of the eyes, it's just blown away by the sensation of having a computer in front of your eye. But what I would say to the patient, I think that it also depends on what type of patients you're treating. If some patients might be very technophilic, and they might be aware of what Google Glass is, and they'd be maybe excited. Some of them might say, I don't want you to be recording me. I think most of them would probably not exactly know what you have in front of your face. And my good friend Denise Silver from Doctors 2.0 in Paris, she coined the phrase, I think it's her phrase, but last year I heard it for the first time. Patients, they want to be cured rather than secured. And I thought that was kind of a cool way to put it. I think patients want to be healed, want to be helped, they want their problems solved, and whatever piece of equipment, be it a stethoscope or an electrocardiogram machine or a fancy ultrasound or a fancy pair of goggles, they really want to be healed, and I think that would be my main argument. This is something that is helping me take care of you, and then we can go to the details of privacy and tell them, I'm not recording anything without your permission, or whatever I record is going to be, kept secured. So all those extra layers of argumentation, I think that are probably due at some point, especially if the patient requests them. But certainly privacy is the main thing, and after that it's all downhill. I think it's a tool that would help us provide better care in an easier way, in a more secure way. Not secure in the sense of privacy, but less errors. I've talked in my conference frequently that the numbers are astonishing. 440,000 patients die in the U.S. a year due to preventable medical errors. And I think that a tool like this, with the potential to improve our connectivity and our communication, and somehow get a degree of artificial intelligence into it, like Google Now, for example. Like Google Now is a digital assistant. Well, Google Now for healthcare in glass, that would be amazing, where you can be alerted before you order a drug to which the patient is allergic to, or you be alerted of a low hemoglobin value on a patient that is going to get a blood thinner, or things like that could prevent you from doing harm to a patient, which we do very frequently in the United States and probably all over the world. It's amazing. Preventing wrong side surgery. The numbers also astonishing. The statistics say that 40 times every week we do a wrong side surgery in the United States. 40 times a week. This is despite the fact that you cannot start a surgery in any patient, I think, in the United States before you have the site marked and the timeout, and you still do it 40 times. So imagine a device like this alerting you of you going for the wrong eye, or for the wrong breast, or for the wrong leg.
And this is still common, that they mark it with a magic marker on the body, the side of the body that they have to do the surgery on, just to make sure.
It's a must,
yeah.
And it still happens. Because you see, we rely on digital records, on electronic medical records. We've been doing it for I think, almost 5 years. I think 2009, when the act came out, that we really wanted to improve on the care of patients. And despite 5 years and many millions of dollars, we're still not up to the standards. The information is inputted by humans. And when you have humans in the equation, you're prone to errors. You're not going to be error-free. So I'm not saying that the human needs to be out of the equation, but if you have artificial intelligence systems or deep learning systems or computerized systems that improve on what we can do, at least in that sense, that'll help us do less harm and commit less mistakes. If someone comes in and marks it right at the very beginning of the chain on the electronic medical record, and all I see is that person before me who marked it wrongly, marked it on the wrong side, that's going to be the side at the time of the surgery, and it happened that the first person on the chain was wrong, and it was actually the left side. So it's like pen and paper. Despite all the years of advancement in electronics, and we go, instead of writing, we type, and it's the same mistakes, but in an electronic fashion.